Super excited to be here, first of all, and a huge thank you to Yola for inviting me out here. I actually had the honor of actually going to Paisley Park last year. Prince is from Minnesota, and no one famous stays in Minnesota, so we're all extremely loyal to him. But he always opened up his studio every couple of years and would basically offer a free concert. And so was really excited. Last year, my husband and I literally had to do 5-hour energy drinks to stay up to watch this. But he offered a free concert at 2 a.m. And it's a gentle reminder that life is short and that you need to capitalize on things that are on your bucket list to take the time to do them. So what am I going to talk about today? When Hills first asked me to give this lecture, it was honestly totally out of my comfort zone. You guys know me. I'm an emergency critical care specialist. I'm a toxicologist. I don't typically speak on topics outside of that. And so definitely out of my comfort zone, but super honored to do it because this is an area that I'm really passionate about. Why? Because you guys have the luxury in private practice of having a long-term relationship with your pet owners. You vaccinated that puppy since it was a puppy. You've euthanized it 15 years later. So you have that long-term human-animal bond with them. That's totally different from what I do in the emergency room. I have no trust relationship with that client. They've never seen me before. They're seeing me in a very frazzled, stressed out environment where I'm telling them, A, their dog has cancer, or B, I need $6,000 to fix your dog. And so really important that you have appropriate client communication. I'm going to touch on some aspects that Andy had previously talked about, but what I was going to do was base it off a couple of life experiences with my two main dogs. My first dog, that was the first dog I ever had as an adult, was a dog named JP, best pit bull ever. He was a Philly special, he had parvo, and he ended up dying of a brain tumor. And I always felt like, and I always prided myself on the fact that I had a really good client communication with my pet owners in the ER. It wasn't actually until 18 years later of being a vet where I was on the other side of the table, where I was the pet owner who was hearing, your dog has a brain tumor, that it really rocked my world. And it changed the way that I communicate with my clients today. So what I was going to talk about today were a couple of main goals. The first goal I wanted to talk about is obviously preserving the human-animal bond by how we communicate to our pet owners. I'll talk about a couple of tips on how to improve this, some that Andy had already spoken on, being an active listener, being empathetic, being sincere, being compassionate, and what other tips that we have to improve that. I'm going to talk about a couple of breakdowns. Where does breakdown happen where we're failing in client communication? When I reflect back during my internship at Angel, I definitely had a couple of breakdowns in client communication. Same thing in Philly during Penn when you have an irate owner screaming at you and you just walked into the room. So again, these are based off of life experiences that I've had. I'm sure you guys have all had these experiences too. And then we'll touch on why this is important with whatever chronic patient that you have, whether or not it's a chronic ADB patient, a chronic DKA, a chronic DM patient. And a couple other goals that we're going to focus on are, does your pet owner get it? So important that you make sure that your pet owner understands everything. Classic example, I've seen interns who have spent thousands of dollars correcting the metabolic acidosis and all the electrolyte disturbances from a critically ill diabetic ketoacidosis patient, only to find out the next day when they transfer to me that the owner, of course, they can't do twice-a-day insulin. They're not committed to that, and then they euthanize that next morning. Again, failure of client communication. Same thing with IMHA. Really frustrating when we treat some of these chronic immune-mediated hemolytic anemias. They may have pet owners that are fully committed, but they may not be committed to the horrible PUPD that happens from the prednisone. And I've had a couple of pet owners who spent $10,000 saving an IMHA to euthanize it 1 month later at the emergency clinic because they're too embarrassed to come back to us because they couldn't deal with the PUPD. They couldn't deal with a 9-year-old dog who's been housebroken all of its life, who's now peeing all over the house. So again, this is all stuff that we should have appropriately communicated to that pet owner from that very beginning situation, whether or not it's in the emergency room or whether or not it's in the exam room. So again, making sure your pet owner gets it. Making sure you get your pet owner. Have you appropriately understood their primary concern? Why are they there today? Maybe they're there for X, and you're pointing out A, B, and C, and it's just overwhelming to them. Taking the time to listen to what they're asking for. Making sure to provide appropriate options for your pet owners. This is an important aspect that I really pride myself on, because nowadays, if you ask someone who just graduated, what do you want to do for this vomiting cat? What's their classic answer? CPC Chem, UA culture, chest abdominal rads, coag, abdominal ultrasound. When in reality, my general philosophy as a vet is treat each pet the way you would if it was your own dog or your own cat. If you didn't get a discount, would you do a CPC Chem, chest rads, abdominal ultrasound? No, you do a big 4, a PCV, total solids, blood glucose, azo, and maybe give it sub-Q fluids. So always being able to provide owners all their options, from the highest level to working with them whether or not it's street medicine. And that's the amazing thing about veterinary medicine. Animals survive despite what we do, despite our improvements in quality of care. So, I wanted to share my first story, which you can tell from the slide, is of skin scraping. You guys, how many of you guys skin scrape at least one patient a day? Everybody. I don't skin scrape. In fact, when Hills asked me here, I jokingly say the reason why they asked me is because I'm a derm idiot. I don't skin scrape, but the dog that I currently have, Milo, a 4-year-old pit bull mix, ever since he was 8 weeks of age, was always pruritic, since he was a puppy. He got scraped, it was negative, he got treated prophylactically just in case it was mange. And lo and behold, a couple of weeks later, he was finally diagnosed with Demodex. And when the dermatologist that I work with on Fridays at the specialty clinic said, oh, he has Demodex, just start him on ivermectin. And she starts walking away. I was like, don't walk away. I don't know how to start a dog on ivermectin. I'm a toxicologist. I'm an emergency critical care specialist. He's part Australian Shepherd. You know, all I see are the ivermectin toxicities. I want to discharge with the mic per kg dose of when I should wean him and start him. And that was one of the breakdowns that I saw in client communication. One of the most common areas I think there's breakdown in client communication is with our own staff. Because we don't ask a whole history. We expect them to tell us if they're coughing or vomiting or have PUPD, but we don't always treat them the way they would be if they were a regular client. Well, 2 to 3 months later, I actually was going to recheck with the dermatologist, and I made an appointment. And the dermatologist was probably annoyed. I took up one of her Friday appointments, but I wanted to be treated the same way as if I was a regular client, and that's what I said to her. And I just wanted to make sure the dog had a negative skin scrape, and she said, oh, I'm just going to cancel your appointment. Just skin scrape it. I was like, dude, I don't skin scrape. Seriously. And I know the dermatologists say it doesn't hurt, but when you have to draw blood, it hurts. And so anyway, she was like, you can do it, just skin scrape it yourself. And I said to her, listen, if your cat came into me dyspneic, and I said to you, just do a thoracocentesis on your own cat, would you do it? She's like, no, okay, I'll skin scrape it. And so she skin scraped my dog. But again, another breakdown in client communication. I wanted to step back and talk a little bit about professional fears. If you guys have ever heard me talk before, I'm a huge proponent of wellness in veterinary medicine, of work-life balance, because I feel like as workaholic, classic INTJ veterinarians, we oftentimes have poor self-care. There was a recent DVM 360 study that came out, and it was interesting to see what some of these fears were. If you look at some of the professional fears, some of them were being reported to the state board. Some of them were not having enough income to pay off the debt due to the debt-to-income ratio. Some of them was being sued for malpractice, lack of balance in their career or professional life, losing motivation for their career or their compassion for animals, or some of it was the stress of dealing with clients. When we look at some of these survey results, about 15 to 20, almost 25% of the fears or stressors in veterinary medicine was because of client communication or dealing with difficult clients. So hopefully this talk will help you feel more comfortable with client communication. I know you guys are all pros at this, but again, just a couple of tips. When it comes to introducing yourself, my general philosophy is I have very high standards for medical professionals. I want to be treated the same way by my MD as I would treat a pet owner. And so when I meet an MD and they have bedside manner, they don't look me in the eye, they feel really rushed, they don't shake my hand, or it's a really wimpy handshake, my impression has immediately changed. So again, really important that when we first go into the exam room, remember the majority of the time that person has already formed an opinion of you within the first 10 seconds. So carrying yourself in a positive manner, looking clean and professional, not having anal gland juice all over you or fur all over you, making sure that you're shaking their hand firmly, that you're smiling at them, that you're bonding with their pet. I know Andy had talked about body language. There have been studies comparing MDs who get sued for malpractice versus MDs who have some of the lowest rates of being sued. And literally, they boiled it down to 3 simple things: sitting at the eye level of the pet owner or the patient. So literally just sitting in a chair. The second thing was making sure that they took the time to ask the question, do you have any other questions I could answer? At the end of the exam. And literally those 2 were the 2 biggest factors in decreasing the risk of getting sued. So again, really important that when we are introducing ourselves to a new client, we're taking the time, and this is oftentimes hard because a lot of us have an electronic medical record. So literally, where I used to work at University of Minnesota, your back is to the pet owner as you're typing, and it's super frustrating. So again, just work with your room as much as you can to be able to face them right away. Another important aspect, remember why you became a veterinarian. If you went into an MD appointment and your MD didn't want to touch you or interact with you, you're obviously going to find a different MD. So taking the time to bond with their pet, open up the cat carrier, that's the first thing you should be doing, is petting their pet. Okay? They want to see that you are bonded to their pet immediately. Another key aspect is active listening. I'm a huge fan of TED Talks. And if you guys listen to one TED Talk this week, I actually recommend the one on active listening. This is by Julian Treasure. It's 6 minutes long. And it basically talks about how active listening is a lost skill nowadays. And this, I promise, will save your relationships. And just instead of just nodding to your husband, I'm like, yep, listening to your story. So unfortunately, we're losing our ability to actively listen. 60% of the time in conversations is spent listening. Only 25% of that time is there actually comprehension. So very, very scary. Yes, we have some verbose clients. Yes, we have clients with really long histories, but really important that we show that we're actively listening. I know that Julian talks in his TED Talk about the acronym RASA: receive, appreciate, summarize, and ask. So body language-wise, like you're receiving, you're actively listening to them. Appreciating, in other words, just that simple that you're receptive to what they're saying and listening. Being able to, what I call chunk and check, I'll talk about that in a few minutes, so that you're summarizing what they're saying or having them summarize what you're saying, and then asking open-ended questions. So really great TED Talk if you get the chance to listen to it. So again, some key guides to active listening include reflecting on what they're saying, reiterating it, and then I always like to ask that opening question, do you have any other questions that I need to answer, or anything else that I missed about Molson's medical history? When I used to be on faculty at University of Minnesota, before we moved to electronic medical records, we would have internal medicine patients come in through the ER, literally with medical records this thick, with multiple volumes. And I remember shocking a pet owner one day when she came in through the ER. She had always just come in through tech appointments or through really quick appointments. And my general philosophy is, if I've never seen you before, I'm starting all over. And I said to her, I hope you don't mind. I know you've been here a ton, but just so I can make sure I'm not missing anything, I'm just going to start all over. How long have you had Fluffy for? What previous medical histories? What's the current diet? And these are questions she hadn't been asked in over 2 years, despite having a medical record that thick. So again, really important. If you're seeing these clients all the time, no problem. But if it's a new client or a chronic patient, making sure that we're not missing anything and that we're actively listening to them. The next important aspect is sincerity. Be sincere in how you respond to that pet owner. And I will say, when my own dog, JP, was diagnosed with a brain tumor, it literally rocked my world. I was one of those pet owners that was pathologically attached to this dog. He was my first adult dog. I got him after my internship. Didn't have any pets in vet school. And this was a dog that had survived many a move to different cities, to different states, many a ex-boyfriend, and a lot of life drama. And this dog was my rock. And literally, every single day in the ER, I always say, your dog has cancer. It's a golden retriever with hemangiosarcoma. And I always felt that my hemangiosarcoma talk and my euthanasia talk were really good. I felt like I was empathetic and sincere. But I can't tell you how much it rocked my world to hear the neurologist say, while we were seated, he's got a brain tumor. And I don't know about you guys, but I was always taught in my training, you don't answer the question, what would you do if it was your dog? That's not the way I was trained at Cornell and Penn. You give them their options. You say, well, and my spiel had always been, well, if you ask 10 different vets, they'll tell you 10 different things. One might do this, one might do this. Technically, I can't answer the question for you, but these are your 3 options. And literally, when Dr. McVeigh, the neurologist at University of Minnesota, told me that JP had a brain tumor, I said to him, what would you do if JP was your own dog? And he's like, Justine, I can't answer that. I was like, no. Actually, as a good friend, I'm asking you to tell me the answer. And so he gave me the classic 3 answers. And then, of course, I neurotically called every single specialist that I know just to survey all the options out there. And since then, literally for a year after JP was diagnosed, it would make me well up, and I'm like classic Minnesotan, non-emotional, don't cry. I would well up each time I said to a pet owner, your dog has cancer. And it was after JP was diagnosed that I actually changed how I did my talk. And when pet owners say, what would you do if this was your own dog? I actually tell them now. And for me, this was a really important lesson because pet owners are literally trusting you on your medical advice on what you would do. And so I think if you have a life experience to be able to share with it, while still providing those options, it's really important in terms of client communication. Now, I was one of those crazy clients that as soon as JP was diagnosed, I called a bunch of specialists, I got in a car, I drank a Caribou coffee and 1 5-hour energy drink, and I drove nonstop 15 hours to CSU to do stereotactic radiation therapy for him. And a lot of pet owners won't do that. And a lot of veterinarians wouldn't do that. And would they spend $13,000 on stereotactic radiation therapy? Probably not. For me, I was still driving a Hyundai. So for me, while I'm fiscally responsible, I wanted to allocate that money if I could get some time with my dog. I was super fortunate. After 1 MRI, 1 CT, 3 to 4 stereotactic radiation treatments, I got 13 months. And I finally broke it down when my partner said, how much time do you need to get for this to be worth it? And I was like, 6 months, a year, whatever. And it turned out to average about $63 a day for his survival, but that was way cheaper than a shrink. So I was actually still happy with my decision. So again, based off that experience with JP, totally changed the way that I communicate with my pet owners. And it really taught me the importance of empathy. I can't tell you how many times I see owners come into the ER, into the specialty clinic to pay my $150 exam fee, a $50 e-collar fee, a $200 medication fee for Genacin spray, prednisone, and cephalexin, plus clip and clean for a hot spot in the middle of the night. And a lot of times we judge those owners instead of appreciating them for coming in. And we're like, why the heck are you coming in to spend $500 for a hot spot at 3 a.m.? When in actuality, if you step back and you empathize, you realize why. With my second dog, Milo, who had Demodex, and I know dermatologists say Demodex doesn't itch, it itches. It really made me empathize because when Milo would wake us up at night scratching, it drove me nuts. We'd be up in the middle of the night with him just scratching, scratching, scratching. And it really made me empathetic to why pet owners even come into the ER in the middle of the night for itchiness. Being able to understand their feelings. Again, classic for me was that scenario of hearing your dog has cancer and change the way that I respond to pet owners. Appreciating them as human beings, even though they're coming in Friday at 5 p.m. for a hot spot or Saturday night at 3 a.m. And we don't always empathize with the underlying issues behind it. We don't always think they're going through a really stressful time. They may have waited too long where we see these really severe situations. We have no idea what's going on through their life. And so just being able to empathize on that and understand and be able to communicate our understanding to that pet owner, which is so important. Totally different opposite views of how we see things. It's all about perspective. When I'm really busy in the ER, there's a 1 to 2 hour wait. We call it the list because we literally list out all the medical records that are waiting to be seen. And when I'm at a Starbucks and the barista is totally behind and it takes me 12 minutes to get my coffee, I'm like, she's on the list. It's just a super stressful day. So again, taking that time to be empathetic, which I think is really important. Hopefully between active listening, being sincere, we can help understand our pet owners a bit better to work together to help solve that problem. The next part is compassion. And I'll be the first to say, I think our field, especially the field of emergency critical care, is fraught with terrible compassion fatigue, which progresses to burnout. My path was a little bit unusual. I was completely clinical. I was in academia for several years, and then I was completely burnt out. And I had always set a rule ever since my internship that if I got sick of touching animals, I would take time off from veterinary medicine. So this was an active goal that I had always set for myself, just so I had a bar to know when to leave the field. And I remember one day at University of Minnesota when I was on faculty, this vet student was walking by with this completely crazy black lab. And at that time, we still had regular radiographs. We didn't have digital. This dog was on a super long flexi lead. The student had no control of it. And I had radiographs in my hand. And the student was walking by in the hallway, and the dog was lunging to jump on me. And I literally took my radiographs. I was like, to block the dog. And that's when I was like, that's a sign of compassion fatigue when I don't want to touch a lab. And so that was my mental priority for exiting the veterinary field. So I actually went into industry for 5 years. And it was actually really interesting because I know a lot of veterinarians, and I'll be honest in saying this, poo-poo industry. They're like, oh, no, I would never go to industry. It is awesome. I used to call my criticalist friend when I was sitting at my desk job and say at 3 o'clock, I'm like, what are you doing? She's like, I'm about to round with the students. I'm super busy. What's up? I'm like, I just want to let you know I'm drinking tea at my desk. And so for me, it was actually the perfect out to regain my passion for veterinary medicine. And it was a great option for me to get over my compassion fatigue and my burnout. Really important that we show compassion to our pet owners, making sure that we're empathetic to the problems that may be affecting them. And once you lose that compassion, it's time to take a break. Okay, so make sure you set some kind of bar for yourself. And again, that was an important lesson for me that I learned with JP when he got that brain tumor. And I guess I was just being really callous to the fact that I say, your dog has cancer. Your dog has hemangio. It's 70% chance that it's malignant, blah, 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 blah. And so really important when it happens to your own pet. Again, it makes you much more empathetic towards that situation. The last part of effective communication, I don't know if you guys have ever done Frank training with Dr. Jane Shaw at CSU. Awesome. One phrase that she uses frequently is chunk and check. And literally, when you are just diagnosing a case of IMHA, they don't want to hear prognosis and outcome and side effects and all the different meds and what the diagnostic plan is. It is way too much information for them to take in. And literally, what I often do, I'll go to a reputable website, print out a handout, document in my client communication, gave them the IMHA handout from petplace.com, let them go home and read on it and discuss it more when they come back to visit. So providing them small amounts of information so they understand the concept, rephrasing it just so they understand, involving the whole family, because in a stressed out person, they may not hear it. They may need a family member to reiterate it. So again, great acronym to remember, that chunk and check. Last important part of active listening, asking open-ended questions. Very simple way, instead of saying, is your dog drinking a lot of water? No. So again, when in doubt, very easy way for you to help build that client communication. Make the effort to understand and build an effective working relationship. When we do that, it helps improve the overall treatment of that patient by setting expectations, making sure that we're offering a plan on how to care for both the pet owner and the patient, and joining together with your pet owner to be able to offer an option and solution regardless of what their financial constraints may be. And hopefully by doing that, again, we can help solve the problem of whatever presenting complaint they came for. When are we seeing breakdowns in client communication? Well, it's when we're rushed. Who doesn't feel stressed and rushed every day in their veterinary clinic? They do. And so, unfortunately, there have been studies that have shown that 53% of working parents with kids less than 18 have difficulty balancing work and family responsibilities. I feel like all of us would say we probably have poor or bad work-life balance, and that's because everyone feels rushed. If I had an MD who was trying to snap through my exam and get out of the room really quickly, I would change to a different MD. So again, make sure your pet owners don't feel rushed, that you're taking the time to be able to effectively communicate and work with them. In another study about trust, only about 59% of millennials said their veterinarian takes the time to know them, compared to 64% of baby boomers. How do we build that trust? I think it's through accessibility. I think it's through transparency. And there's a couple of simple things we can do to build that. First of all, when JP survived way longer than I thought, I was actually lecturing in Thailand when I got a text from my pet sitter that she had to bring him to the specialty clinic because he was seizuring. And of course, I'm thousands of miles away, completely stressed out. And one of the emergency vets literally just texted me a picture of him in his cage. And it made me feel way better. So it could be something as getting a clinic phone where you can text your pet owners, just even a one-liner. Dog's waking up, or Mojo's waking up fine from his dental. And that helps them feel like they have more accessibility. It makes them trust you more. Another important aspect is transparency. Today's pet owner is an educated consumer. They want to be able to price shop. They want to be able to look at whatever 1-800-MEDS versus Amazon versus other sources. I know that there's this huge debate about how much investment veterinarians should make when it comes to selling pharmaceuticals. Be transparent. If your owner knows it's cheaper here, you have to be able to say to them with certain prescription medications, those are medications that were illegally purchased, they're not backed up by the company through adverse event reporting. We don't know the reliability of some of these products. And as long as you're transparent, again, that helps build the trust with your pet owner. The last thing I wanted to touch on is using too much medical lingo. I always try to reflect back to my first year when we didn't know anything. We didn't know what Eupnic to Kipnic was. We didn't know what tachycardic was. We didn't know any of these big words. Pet owners don't get what renal is, right? They only know kidney. As a toxicologist, people don't know what toxicity is. They only know what poisoning is. So making sure we're using appropriate layman's terms when we're explaining things to pet owners also helps build our client communication. Ultimately, I know you guys are all experts in this area, but again, take the time to be an active listener. Be empathetic, sincere, and compassionate. Treat each pet the same way you would if it was your own pet, or how you would want to be treated if you're on the other side of that table. Again, remember the breakdowns. Try not to make the pet owner feel rushed. build that trust and rapport, be transparent with them, and make sure that you're accessible to them. Ultimately, by doing this, hopefully we can improve our quality of care in our pet owners, especially with some of these chronic cases that we're managing. And with that, I'm happy to answer any questions you guys might have.
Thank you so much, Justine. And I can tell you, I would drive 1,500 miles to go to your clinic if I have an emergency. So
I'm very expensive, very expensive.
Caring but expensive.
Yes.
All right, great. So what I would suggest, because we're running a little bit out of time, one short question, and then does anybody have something to ask for Justine? Yep. And use the microphone, please.
Wait, what?
The microphone. Yeah, because we still have an audience outside of this innovation sphere, and so it would be really nice. Go ahead.
What made you want to get into the vet girl and really put everything out there? If you struggle with compassion fatigue and work-life balance, what made you want to go this route and share this?
Great question. So I feel really blessed, and I feel like we're all really blessed in our veterinary field in that we can do anything. We could go into industry, we could take time off, we could become a state vet, we could do different aspects of public health. I'm super passionate about providing clinical CE, and I will fully disclose I was a total C student at Cornell, and I totally block out the pathophys and that aspect. I just wanted clinical vignettes that would make me better as a clinician. And I felt really fortunate because of some of my past experiences to be able to go from industry to clinical practice, to be able to do something that was totally outside of the box. I'm a unique vet. I work at a specialty clinic 2 days a week. I work from my desk 3 days a week. I work for multiple consulting companies, for ASPC Animal Poison Control. I lecture for Merck, a couple of different companies. And so for me, between all those different positions, it let me establish work-life balance. And just being able to take a year or two off from the clinical field allowed me to be able to get over my burnout. So really important. And I know it sounds crazy. We all work really hard in our fields, but it is important to have that bar when you realize, you know what, I'm getting burnt out. I need to do something a little bit different, because you're not doing a service for your pet owners or for your clinic when you're fried. So I'm a huge proponent of self-care. And I think this is especially important because of the high prevalence of suicide in our field. We all know someone who's committed suicide. I've had 6 colleagues commit suicide. I struggled with suicide, depression, and insomnia during my first year of my residency. And that's why I'm a huge proponent of taking care of yourself, even if it means taking time off from practice.
Great. Thanks, Justine. Very wise. Thank you so much.